Welcome to the Interagency briefing on Ruggedized integrated mobile life support with our good friends here, Bob Sullivan with the best headshot I've ever seen. Like he's a late night host.
Smoke and mirrors.
And Derek Watt, who absolutely is carrying a very cool piece of equipment. We'll talk about that in just a minute. Welcome, Derek.
Thank you.
So good. We also want to welcome all the folks that are here today. We got a lot of folks from VA. We got folks from the Marine Corps. We're going to be highlighting some things about the Marine Corps. A bunch of folks from DHS, from different agencies, and some of the special ops folks, the Navy and Army. There's a lot of interest in this. We will be highlighting what's happening with the Marine Corps, and this will be the best briefing ever. So here it is, Derek. If Michelle learns something new, it'll be the best briefing she's ever been to. So there's the bar right there. So she learned something new. So Kirby, we just talked to Kirby. If I can help pass this training on to medical first responders like his fiance for whom he works with, awesome. Bryce, if it covers pricing, so we can talk about pricing if needed. Jason, it's informative and not a sales pitch. Not a sales pitch, Derek. So there you have it. Kenia from FEMA, we received the needed resources to effectively and efficiently complete the mission. Love it, love it. Hopefully we can do that. And please address Kirby again. That's why I muted him earlier, because I knew he was a superstar. How can my agency get others trained on this system? Love it. Dave from FEMA, lead time to deploy a site. Very good question. Steve, which agencies are using this? We will definitely talk about that. And Malcolm, is this self-contained? What functions are provided? We will certainly go there. And if you want to participate, you can. It's actually simple. You can chat, you can raise your hand, and you can even fill out some Q&As if you need it. We'll do our best to answer those questions with you throughout this and at the end for sure. If you like the way that Bob Sullivan is dressed, even or Derek for that matter, you can expand their size by dragging that little doodah. That's the best thing I got, guys. I don't know what that thing's called, but we call it a doodah here. So you can make it bigger, and you can also change some of the modes. If you're new to Zoom, mess around with that, and you can certainly do that. Let's see, we got some chats coming in. We do have some folks coming in, and you will be provided with a printable version of this presentation. You will absolutely get that. And we'll talk about that in just a minute. But before we do, this disclaimer is not affiliated or endorsed by DOD or the Marines or any other agency. It's provided to you, the audience, for informational purposes only. All participation by you in this briefing is voluntary. And if you would like to engage, it is not an indication or endorsement of or commitment to purchase from any vendor, including Thornhill. Now that we got that out of the way, you can actually talk, because that's governmentese for, hey, we can now communicate. So session agenda, we'll talk about some introductions. We'll give you who Bob is, who Derek is, why they're here. We'll talk about portable life support systems, some of the agency challenges that are out there that you see. As a matter of fact, Kirby was just talking about some of those. Emergency and disaster response. We got folks from FEMA that are interested in that part. And we'll talk specifically about some use cases for what is known as Thornhill MOVES SLC. So you'll see some of that. We'll get to your questions and we'll do our best to answer those and get you out of here on time. You will get a briefing presentation in the link to the chat. We're trying to, we know that there's an issue with Dropbox, so we want to make sure we fix that in order to be able to have you get that. So we'll make sure, no matter what, you're going to get a copy of it. So let's find out why you guys are here. Do you use mobile ICU equipment? I'm responsible for medical modernization innovations. Love those folks. And you can answer as many as you want, I think. I heard about the Marines' use of an integrated mobile ICU. I procure medical devices for my agency department. COVID, nothing like another thing talking about COVID and medical requirements for ICU. I have a need for a mobile ICU surge capacity, or my boss made me come. Just in case you're commanded to be here. There's got to be somebody that's a smart aleck that fills that one out, guys. So we'll let you do that. And with that, we're going to get started with a little bit about Thornhill while folks are answering those questions. So tell us, Mr. Bob, what what is Thornhill Medical, and I know you're up north of the border.
Sure. Thanks, Dave. So yes, Thornhill Medical is a Toronto, Canada-based firm. We've been around since 2004. We're an offshoot of the Toronto General Hospital and the University of Toronto.
Nice.
So we have academic and medical roots, and we have specialized in what's really our core competency is around respiratory medicine. Our founder, Dr. Joe Fisher, is still involved with the company and still a practicing anesthesiologist. Has spent the most of his professional career focused on respiratory diseases and the treatment thereof. So when you take a closer look at our portfolio, you'll begin to understand that much of what we do treats respiratory diseases and or aids in the delivery of anesthesia.
Awesome.
I can quickly run the group through what we do have on offer as a portfolio, not to be salesy, but to be informative. I think what we're going to spend the most of the day talking about is MOVES SLC. Another device we won't spend any time on today, but is also of use in either surgical needs or mobile surgical needs, or a whole host of other uses is a mobile anesthesia device. One of our first innovations, and I think the first product we brought to market, is ClearMate, which expedites the clearance of carbon monoxide poisoning, ideally at the site of injury, but it does away with the need for a decompression chamber and expedites the offloading of carbon monoxide at 3x the rate of hyperoxygenation, which is the standard.
Absolutely, and that's a unique product, I think, from what I've heard. And you guys have a lot of experience in this space. We will be talking about the MOVES, especially as it's implemented and used through the Marines case studies and the other case studies. And you have just a few patents out there, so as well as reviewed articles. And you guys actually developed MOVES in partnership with the Marine Corps, which is fascinating to me. How did that start out?
Yeah, so I'll jump in. Thanks for everyone for jumping online here. And so, way back when, 2004, 2005-ish time frame, our chief scientist, Dr. Joe Fisher, came into connection with a gentleman by the name of Tommy Eagles, or Tommy Doc Eagles, a very highly decorated Navy corpsman, who was looking to modernize medical equipment that the United States Marine Corps was using. And one of the particular challenges was to be able to provide ventilation and oxygenation to patients while effectively eliminating or significantly reducing the requirement for carrying compressed oxygen cylinders. And that's really where Joe was able to use his knowledge in respiratory physiology and to start laying the groundwork for the development of MOVES and MOVES SLC integrated life support systems.
That's wild. And I can imagine that having bullets flying with tanks of oxygen, not the best outcomes from that. So let's talk a little bit about some of the what happens in mobile life support right now. And Derek, I think this is great for you to talk about since you were involved in this from the beginning.
Absolutely. So, when we're talking about mobile life support or mobile, austere, challenging and environment type patient care, there's a lot of pieces of equipment that you're going to potentially require to be able to perform that function, whether it's a field hospital or during transport. The things like patient monitor equipment, your ventilator, your oxygen, suction devices. It's all, generally separate pieces of equipment, whether you're in a bricks and mortar type hospital or ICU or in a military type environment, large footprint, and especially, the availability and the maintenance of and transport of oxygen cylinders is certainly a big part of that.
And what are we looking at here? Because that's a pretty complicated piece.
Yeah, and this is where we originally came in with our first generation MOVES integrated life support system was seeing, these kinds of setups for patient transport. You see, there's a lot of equipment. There's very minimal patient access. You're working in what is a hectic environment and trying to keep someone alive and sustain life. And you're going to have to work with a lot of different equipment with, different knobs and buttons and batteries and screens and displays, and it's not terribly conducive to having the best patient outcomes that you can.
And it's incredible to see. First of all, hats off to the folks that are helping save these lives, because this is real life and very important pieces. Most of us don't deal with saving lives, or at least I don't every day, but I am deeply moved by seeing how what expertise is necessary for this. And one of the things is, and we'll talk about, but just about every agency, anybody that's in first response, getting them connected to life-saving equipment quickly is critical, isn't it?
Yeah, absolutely. I mean, you need to be able to pull this equipment out. You need to know how it works. You need to be able to set it up very quickly and get it operational. Just some of the points I see here on the slide, being able to have people adequately trained on equipment that at times is purpose-built for military or disaster type applications. It may not be what they're used to using in their, civilian life. Oxygen availability is certainly an important piece as well.
Yeah, somebody brought this up earlier about a problem. Did you say, Bob, that there was a problem in Egypt, or where was that?
Well, yeah, sure. I mean, the pandemic has exacerbated things like the availability of oxygen. We've heard that, recently in Egypt, yesterday or the day before, it was reported that either their oxygen concentrators or their oxygen making devices had gone down, their supply chain had gone down. And so they suffered, some ICU patients suffered needlessly for the lack of oxygen. And we've also heard reports, even in our developed economies here in Canada and in parts of America, where either the oxygen making equipment has failed and or the supply of oxygen was not readily available. So we help solve that a bit. I know we're going to go into it in a touch, but we have an oxygen concentrator on board. We actually pull the nitrogen out of the air, and through a rebreathing circuit, we're able to provide the patient oxygen without supplemental or canistered oxygen. Mm-hmm. So, some of the scenarios that Derek was talking about and that the former photos spoke to are environments where those patients need an external supply of oxygen. And, today the standard is basically to bring canistered oxygen into the field. And the innovation that we brought forward through MOVES and the device we're talking about, the next generation MOVES SLC, is that we're able to pull the nitrogen out of the air, focus oxygen, because I think it's 21% of the composition of the air or something like that. Someone could probably correct me on that. Yet nonetheless, we're able to sort of concentrate it, and with your own rebreathing, give you comparable oxygen availability as you might get from an external supply of oxygen. Moreover, we provide invasive and non-invasive ventilation for patients who are in critical need of oxygen therapy.
And I'd like to just add on to your point, Bob, is that for anyone on the call that's familiar with your standard emergency or portable or transport type ventilators, is that they use an excessive amount of oxygen. 8, 10, 12 liters a minute of high pressure oxygen is required, often to give patients that very high inspired oxygen concentration. And we utilize a very unique rebreather ventilator in our device, very similar to an operating room anesthesia workstation, that allows us to sustain that patient on low flow, very low flow oxygen.
That's fantastic.
And Dave, not to belabor the point, but I don't want to glance over the patient monitoring attributions we have here, because many times, we give therapy and we want to see the results of that therapy as caregivers. And the challenge to do that is that you need to have some array of patient monitors. And a lot of the images we reviewed previously is those patient monitors. And condensed in the MOVES SLC is your pulse oximeter. We have, 3 different invasive pressures. We have a non-invasive pressure cuff. We have Untitled CO2. We provide 3-lead and I think 12-lead ECG. So in truth, everything you would expect at a critical care bedside is had in a 40-pound piece of equipment that has been built for that environment.
And we're gonna cover that in some detail for everybody that's here. I just want to make note that anytime you have so many different pieces, you have multiple points of failure, and that's one of the biggest. It's one of the most critical components, anyway, that the Marines were after to try to eliminate that. And I'm going to ask the folks here, if you're talking about your critical life support, and especially in the mobile world, how many different pieces of equipment do you have that are used for critical life support? A lot of folks were telling me the other day there's more than 5. I don't know, because I faint at the sight of blood and needles. So I am a terrible example of this. So, but we'll let us know what you guys normally see, and it's okay if you're not sure. That's okay too, right, Bob?
Sure. I mean, and it just depends who's joined the call, because those who are at the front line will know this more readily than those who are either procuring or program managing for support of those people at the front line. But it's definitely a challenge, and some of our systems been optimized for that. The paramedics have some compact pieces of kit that they bring into the scene. Sure. But many people may not recognize how many independent devices are required to give first grade medical care.
You bet. All right, so everybody can see that there's a bunch of different folks. We really appreciate you guys participating, and let me make sure that that disappeared. Did that disappear for everybody? I think so. Fantastic. I got another one here. All right, so what you just mentioned, Bob, is the fact that this is a 40-pound unit that's integrated. So what is it called? What do you call this? Moves.
It's Moves SLC.
And this is the latest generation. You've had multiple generations with the Marines. Is that right?
Yeah, that's right. Yeah, the Moves first generation, same idea, just a little bit larger, a little bit heavier, a little bit less capable than the current generation Moves SLC device. And I think we talk a little bit more as we go through the use case how that's expanded. Yep. The device, again, a lot of it is that integration of function, addressing this sort of patient access and logistics piece. I think it's certainly important. The idea of developing a system that's agnostic to the environment of use, hot, cold, challenging, in an aircraft, in a vehicle, stationary, making it rugged and to military specifications allows it to be used in those types of environments.
And it's not just military, right? Because it can be used in civilian applications as well, and emergency response, all those, right?
Absolutely.
But I'll say this: if it's good enough, if it's rugged enough for the Marines, chances are it's rugged enough for the rest of the world, wouldn't you say?
That's right. It's an advanced kit. I mean, it meets the standards for critical care ventilators. It meets the standards for transport ventilators and for civilian patient monitoring equipment that you'd find in a hospital. We've taken the design cues, from the type of equipment that, civilian physicians would be used to using and putting it into a package that can be deployed, as you see right here, not only in a bit of a transport type environment, but on the right there, there's your transport, and then, on the right into that sort of, location of convenience, whether it's disaster or military, to sustain life for emergency surgical procedures or maintaining life for critically ill patients.
That's fantastic. Now, this all started with the Marines, and there's a specific reason for them connecting with you. And that is really in the place where it's circled, right? That's where you would normally expect for tactical response, right?
Yeah, that's right. So the first generation MOVES device was very much purpose built for that tactical medical evacuation type mission that you see there in the 1 to 24-hour range. I think once the devices were fielded, there is people see the use case for a MOVES device as it spreads into those role 2, role 3, prolonged field care, forward surgical teams. Sustaining life, and a lot of that went into the design and development of the current generation MOVES SLC, adding additional critical care, ventilator modes, patient monitors, to allow for that expanded use case, expanded use environment to really kind of start to look at the entire continuum of care, at least within the military space.
And I think the continuum of care, where you have the ability, you can be in theater, you can be wherever the accident happens, or if it happens to be a first responder of any kind, to have that unit all the way through that. And then once you get into the standard ICU in a building here in the States, if you look at the Marines out, in theater, and then transportation all the way here, they can stay connected to that one unit. Is that right?
That's right. Yeah, absolutely. I mean, you start to look at avoiding those kinds of equipment handoffs where you have to disconnect equipment and reconnect. I mean, those are danger points when you're moving a patient along, through the different roles of care. I just saw a question pop up that I can quickly address.
Okay.
To be clear, the device was, it's designed to be battery operated. Long battery life, hot swappable batteries really give it the ability to be set up where you don't have that traditional infrastructure. I think a key point in the Marines use case as well is that they're not operating dedicated medevac vehicles. And so the device is designed to be agnostic to how it's being moved or where it's being placed. It gives that medevac capability to, whatever mode of transport you may have to use. And of course, it can be plugged into wall power as well.
That is fantastic. And that's when you look at what the Marines were asking for, this is why we're featuring this today, because it's flexible enough to handle all parts of that, which makes it quite unique.
Absolutely. Yeah, flexible. I mean, you talk about simple adoption curve as well. I mean, I've had the pleasure of training, medical staff that could be as junior as, a year or two, into their medical careers, medics and nurses, up to, anesthesiologists with 30 years of experience. And they all take to the device. They see its application. They find a use depending on what their responsibilities are within that continuum of care.
And you can't underestimate that in importance when you're talking about seconds, meaning life or death, right? That just becomes so critically important. Well, that is awesome. Here's a couple of examples of what you guys have done here. These are real life saving.
Yeah, I think I can talk to this as well. So, I mean, the MOVES SLC, it's been a product since 2017. Our first customers were the Belgian Armed Forces, and these are some photos they provided of use case in those types of forward ICUs, locations of opportunity for doing surgery in areas such as like Iraq and Afghanistan. And, I can tell you as a little side story is that I had the opportunity to go and train the users who took these photos after they'd taken these photos and used the device. They were able to pick up the manual back when we didn't have, nice online training video on our website for anyone who'd like to go and see that. They packed it into their plane ride to Afghanistan. They read the manual, and within days they had the device set up as their primary life support function in these types of use cases.
That is fantastic. Well, congratulations on that. I know that is incredible to be able to bring that to the folks that are on the front lines, for sure. So we got the Marines. We do have a question. How much does it weigh? It weighs 40 pounds. I think, if that didn't get translated to everybody. And let's talk about this, some kind of new thing called COVID. Have you heard about this? I mean, apparently it's sweeping the globe. Don't mean to make light of that, guys. I know that there's one of my best buddies has it right this minute, but it's an incredible thing. So tell us what you're seeing out there when folks are calling you.
Yeah, absolutely. So, as part of, our Thornhill's response to COVID, we've been working hand in hand with our Canadian government partners. You can see FAC at the bottom. That's the Public Health Agency of Canada. That would, I guess, be similar to, on the United States side, maybe the HHS or FEMA. Maybe EMAT is within our province of Ontario. It's the Emergency Medical Assistance Team. They probably would be more equivalent to your FEMA capability in the United States. And they see that pandemic surge stockpile use case that does, can be very similar to that. The military certainly has its different aspects. Some of the use cases we're now seeing, we've supplied now in the hundreds of systems to these entities. We've provided training, and they start to look at deploying systems. In fact, some of our MOVES SLC systems have been deployed. And those use cases, I've got surge overflow, ICU support. I think everyone understands, as we're getting sicker, patients with COVID, that the hospitals are running out of capacity to treat those that are ill. And, the MOVES SLC, because it's, the traditional infrastructure of wall oxygen or power or, even environmental control units are certainly much more relaxed with MOVES SLC, that it can be used as a tool to allow those hospitals to build some emergency capacity, improvised ICU facility. I think we've all seen that on the news, whether it's in a parking lot or, in a warehouse or a convention center.
Kind of like this.
That's right. Yeah, that's your New Orleans Superdome, I believe, in Katrina. Mm-hmm. And then some of the other use cases, if you want to maybe flip back a slide, is we start to look at, remote and rural community, what I call, prolonged field care is certainly, a term that's thrown around a lot on the military side, but for those communities that perhaps don't have the capability to sustain life for those that are very sick, MOVES SLC can be deployed, or is being deployed, certainly in Canada, into some of these remote areas to give them capacity to provide prolonged field care as they're waiting for that patient to be transport to a more perhaps urban center where they have a higher echelon of care. The patient transport piece, I have to mention it as well. It's somewhat forgotten, but in particular, I talk about our provincial in Ontario management of patient transport. They have, same as the care facilities, they have different, echelons or capable type aircraft. Some are highly outfitted for the most critically sick, and some less so for lower priority patient transports. And the MOVES SLC, it's been evaluated for airworthiness by the Department of Defense. It can be utilized to make those whether it's aircraft or ground transport vehicles much more capable to become medevac type vehicles to move patients from areas where perhaps they don't have the capability to sustain them to the higher echelons of care, as it were, I guess.
Yeah, absolutely. And what I like about what I've heard from the folks that have used this, the fact that it keeps coming back to flexible, whether it's tactical or not. I think the flexibility and the fact that you have the ability to replace so many pieces and make it so useful. So I know you guys do a great job on getting this out to market. That was one of the questions. How long does it take to get this out into the field?
So yeah, Dave, I'll take that. I mean, I guess it depends. It depends on, how big the urgency is. We've met the moment here in Canada. The Public Health Agency of Canada called on us, EMAT called on us, and we scaled up our manufacturing to meet that need. And now we've got more or less a sustained manufacturing and supply chain. So, the question is, it depends on how big the deployment is, how big the need is. But we've met every challenge that's been thrown to us so far, and we're anxious to help wherever we can. I know I've tried, and other members of my team have tried, sort of an extensive outreach to those areas that are particularly compromised, that are having a pandemic surge, with the belief that we offer something unique that isn't commonly available, and that we think we can meet the moment.
So when you get the feedback, Derek, from the folks in the field, what are they saying about the fact that it's integrated? Obviously, ruggedized is really important because that keeps it running. But the fact that it's integrated, flexible, and how easy it is to pull together for their team to use.
Yeah, absolutely. I mean, let's talk about, I need to set up, a care bed somewhere. I can open a single case. I can take out a single piece of equipment. And I can start with, something as simple as, providing some supplemental oxygen via nasal cannula, some non-invasive monitoring, pulse oximetry with that device. At the same time, the patient that shows up needs to be intubated and ventilated and starts to require perhaps an arterial blood pressure line or extensive ECG monitoring. That also is, that can be done with the device that's there for, the maybe lightly sick to the sickest type patients. And they're able to take to it very quickly because it's all, again, you've got it all there. There's one power button, there's one jog wheel, there's one yes or no button. It's confined to a single piece of equipment. And I think the example, that I brought before with our friends in Belgium is that, they felt comfortable enough with almost more or less no training, just reading the manual to go and to start to work with some of the, some very serious trauma patients that they could rely on the system to do what they needed it to do.
And you can't underestimate the importance of when you have multiple manufacturers. Now you have one throat to choke, and that would be Bob. In fact, Bob, Anita's asking the question: do you sell these or rent them?
So our classical model has been to sell them and then support that with warranty, but we are open to any sort of acquisition schemes that meets the customer's needs. It's really about the customer, Dave.
Yep. Imagine that. Don't want to get too salesy now, Bob.
No, sir.
But yeah, I'm sure that you'll be able to figure that. All right, so we're going to get you out of here in just a few minutes. We would like to know what you would like. And then would you like more information on the Marines case study? Would you like to schedule a dedicated briefing to review product specifications within your applications? Always interesting for that. To discuss new technology with your agency and department, if you want to spread it out a little bit further, or something else, please contact these guys. We will have them contact you for sure. So let us know what you need, and we will get to any other additional questions. Let's see what this, let's see, one is there. Okay, so we already answered that one. I don't know how to, it's not letting me get rid of that. So any other questions? We did mention that it's 40 pounds. I think we got that out there. The power requirements, we did that with its battery redundancy. Anything else you want to talk about with the power?
No, I think Derek hit upon it. There's two large battery compartments, and because of the sort of power supply redundancy built into the device, we can hot swap a declining battery, send it off for recharge, and put in a fresh battery. And since there's two compartments, we could do that sequentially. So you can really, thoughtfully keep the device operating in a critical care setting.
We've talked about it quite a bit. I think we've addressed the kind of value add aspects of pulling the equipment together, which I think is certainly a very important piece on this. And, to that, one thing I've noticed, especially, I'd say with whether it's military or civilian applications, is that, myself being an engineer and not a clinician, is that in talking to the clinical side and explaining the functions of the integrated pieces and how they all work together, is that I'm constantly, you know, presented with new use cases that I wouldn't have thought of. They find a way, find new ways to kind of take this tool that the MOVES SLC is and find new ways to address the problems that they face. It can be a solution for a lot of different reasons.
And that's what you're finding, especially since COVID came along, right? There's and the reliance on the respiratory functions and how you have that all packaged together. And we all know about the challenges with ventilators. And now that the ventilators are up to snuff, there's other pieces too, right? It's a lot more than just a ventilator.
Absolutely.
Right. So with that, any other questions before we pop on to getting you guys out of here? Just want to make sure I caught everybody. We got that one. Anita, I'm hoping that answered your question, but we'll make sure that there's a follow-up with you for if you have a specific application for rental. And with that, speaking of rentals or buying, you don't have, like I said, there's no obligation to purchase from anybody. However, if you would like to purchase something or talk about it, you can reach out to Thornhill Medical just like this. You can hit them on the govsupport@thornhillmedical.com, or you can give them a shout. You are available through some partners that do service the government, right? ADS.
Yeah, Dave. So that's our blue chip distribution partner in the U.S. ADS serves mostly the American military, but they're deployed coast to coast.
Yep.
They have a TLSA agreement that if you're procuring through government sources can be done through the TLSA agreement that they have. Our other partner is Panakia, which is a disabled veteran-owned small business, and they can also talk to you about different and varied ways to procure the equipment.
Perfect. And so you can reach out to them there. And otherwise, you will get a recap email. You'll have a copy of the presentation. We had a couple folks that had to go off. We have a link to the video as well. And you can reach out for one-on-one discussion to talk about specifics within your agency or department. I know that they're excited to help you any way that they can. And with that, we're going to let you guys out of here. If you want to reach Bob, there's the number, extension 232. Same number for Derek. And that is one of the manliest looking things, man, as you're carrying that around. Just saying, Derek. Just saying. Extension 285. You can reach out to both of those folks. And I just want to thank you guys for being here. Fantastic. Learned a lot since we've been talking about this with you guys. Learned a lot. Anything else you guys want to talk about? I'm sure that there's some pieces. I know that my beloved Ravens went down in flames. So sorry.
Yeah, no, everybody stay safe, stay healthy, and we're here to support when you need us.
Absolutely. Appreciate you guys. Very good stuff. I'm hoping that you have some good feedback from this on where you can help the folks on the front line. Derek, Bob, thanks much. And appreciate
Thanks,
you
Dave.
guys.
Thanks everybody for joining us. Appreciate it.
You got it. Thanks, guys.